National HIV Testing Day is Monday, June 27th. That is a reminder to get the facts about HIV, get tested, and take care of yourself and your partners. New Hampshire State Epidemiologist Dr. Ben Chan joining us now to speak about this important topic. First of all, Dr. Chan, who in New Hampshire should be getting tested on a regular basis for HIV?
That's a good question. As most of your viewers probably know, HIV is the virus that causes AIDS. Now, there's no cure for HIV, but there is treatment. And so the reason to test is that people can be detected earlier these days. People who have early treatment for HIV can help prevent spread to other people. And it's also it can prevent spread to other people, but it's also a way to help people have normal lifespans. The CDC has recommendations for who to test, and they recommend that everybody aged 13 to 65 at least have the test once in their lifetime. People who are at higher risk, so people who are having multiple sex partners, people who are having men who have sex with men, people who are injection drug users should be tested more often, at least yearly. Sometimes that ends up being every few months.
We're hearing a little bit about a new technology that can detect HIV. You mentioned this just a minute ago. They can detect it much earlier in the infection process. Why is that important?
So some of the newer blood tests, what we call the fourth generation blood tests, can detect the HIV virus anywhere from 2 to 3 weeks after somebody becomes infected. So again, that's important because the sooner we can detect HIV, the sooner we can get people into treatment. We can make interventions to prevent the spread of HIV. There are more rapid tests, or what we call rapid tests that people can use in the doctor's offices. These are oral swabs that can detect the antibodies in people's saliva. They're quicker to do. People can have results in about 20 minutes. Unfortunately, there is a lag time between when somebody's infected to when these tests turn positive.
And there's been so much great work in this field that's making so much progress. What kind of new information do we have right now about things that can prevent HIV from even infecting someone in the first place?
Yeah, so in general, we recommend people practice safe sex. Monogamous partners are preferred to multiple partners, obviously. People who do have sex should use condoms. There is a treatment called PrEP, or pre-exposure prophylaxis. This is where healthcare providers can prescribe to patients a pill once a day. These are the same kind of pills that people take to treat HIV infection, but it can be used to prevent HIV infection. It's important that people take these pills every day. They need to follow up with their healthcare providers every 3 months with routine blood work. And the PrEP medication can help people, can help prevent infection if they're exposed to it, can prevent the infection from setting up shop in their body if people are exposed to it through a variety of risk factors.
Dr. Benjamin Chan, State Epidemiologist, with another great prescription information and all these things for the people of New Hampshire. We thank you very much.
Thank you.
All right.